So this video will be teaching you how to do the subcutaneous injection, which is most common with semaglutide. And again, pay attention to your dose. We will be adjusting the dose as we go along, but your initial dose we'll talk about in the office, and it's going to be on the bottle and instructions when they first come. So we talked about loading the syringe with the medication on the last video. This video, we're going to teach you how to inject it. Now today, I'm going to be just injecting 0.1, which is where most of the semaglutide starts, is at 0.1. So you can see it's a very small amount. We've measured the amount of medicine on this little black stopper right here, and you can see it's just a little bit of medicine, and on the syringe you can see the numbers for 0.1, 0.2, and we're going to be slowly moving up the syringe with time, but we're starting at 0.1. So the way that we do this injection is we're going to have an alcohol swab, and the first thing we're going to do is pull our shirt up, grab some of the belly fat, and then you just wipe the belly fat area and keep it in your hands just like this in your fingers, and just clean an area where you're going to inject. Then we're just going to slide the cap off, and now we have the needle exposed. As you can see, it's very, very tiny, very tiny. And then what we're going to do is just take the needle, and you'll just lightly push it into the belly fat, which you may not even feel, and then you're just going to push the syringe in, and that's it. It goes in relatively quickly and painless, and then pull the syringe out. Now, we want to get rid of these syringes, okay? So we don't want to just leave the needle exposed. What I'm going to have you do is bring the cap back, and don't push the cap on because sometimes we miss and hit our fingers. So we're just going to drop the cap on and then tighten it. And then now that's protected and you can't poke yourself. So to discard these, you can either do a couple things. You can save them and take them to a local health department and they'll discard them for you. Or you can put them into a plastic bottle and then you can put the cap back on a plastic bottle like a Gatorade or like a pop bottle, and then put the cap back on and you can throw them in the trash. My suggestion is please take them to the health department. Put them into a bottle, take them to the health department because you're going to be using these frequently. So that's how we do the subcutaneous injection. If you have any questions, again, let us know and we'll see you next video.